Congressman Gary Palmer is kind enough to join us this afternoon to talk about a couple of key issues before we head back to Washington. Congressman, thanks for being with us. Let's start with the bill that you've introduced about coding, and this is a fairly inside baseball thing. If I can boil it down, it seems like basically what this bill tries to do is keep small rural hospitals from being penalized if they mess up somewhere along the line in paperwork.
Right. What's happened is the Centers for Medicaid and Medicare, or Medicare and Medicaid Services, has implemented a new requirement for coding that's forcing doctors to go from a little over 16,000 codes to over 63,000 codes. And a lot of these small physician practices, even in some of the suburban areas, and these smaller hospitals are not prepared for it. And CMS has sent them notification that if they're not ready, they need to get a 6-month line of credit, because if they miscode something, they won't get reimbursed. Well, the vast majority of their patients are Medicare and Medicaid patients. So my concern is that these patients are going to lose access to health care in their communities. So I introduced a bill that would give a 2-year grace period, so that as they're trying to adapt to the new codes, if they make a mistake, they will not be penalized by having the reimbursement withheld. If we don't do that, I'm afraid that a lot of these physician practices and a lot of these rural hospitals are going to close, and you're going to have people in Marion County or Perry County that are going to have to drive 2 hours at least to find a hospital or to see a doctor.
What do you think the chances of passage are, given all the other things that are on the legislative calendar there?
I think the chances are pretty good. We've got over 40 co-sponsors right now. Key committee chairmen have co-sponsored. And plus, the American Medical Association has come out for this. They think this is a reasonable thing to do, and the Medical Association state of Alabama. And we're seeing other medical associations around the country come out in support of it as well. So key is to get information out to people so that they know what's going on. They can contact their members of Congress and let them know, and get the doctors informed about it. And it really does help the doctors focus on taking care of the patient and not be so worried about how they code something and being fearful they won't get paid.
Patients, not paperwork, in other words, right?
That's a great line. I wish I thought of that.
You can have that one for free.